I was reading this article about methotrexate errors, and it's really unsettling. Have you
Yeah,
heard about it?
I did. It's alarming how these medication errors keep happening despite all the warnings.
Right.
What's going on there?
Well, apparently, even with all the campaigns and packaging changes, the number of
hmm
errors hasn't really decreased.
That's incredible. So methotrexate is supposed to be taken weekly, not daily, right?
Exactly. And that's where the confusion comes in. It's like, it's not following the usual
Right.
routine. Most medications are daily, so it's easy to slip up.
But shouldn't healthcare professionals be extra cautious with such medications?
You'd think so, but high workloads and distractions make it challenging.
hmm
Even experienced nurses have made this mistake.
Like who? Do you have an example?
Yes, actually. There's a nurse named Klaus who, despite years of experience, dosed methotrexate daily by accident.
Oh
The
no.
patient ended up with severe poisoning.
That's terrible. What happened to Klaus?
He faced disciplinary action and was publicly criticized. It
Wow.
really affected his career and self-image.
I can imagine. But were there any systems in place to prevent this?
There are warnings and protocols, but they aren't foolproof.
Right.
Distractions during medication dispensing can lead to errors.
Maybe the environment needs to be changed? Less distractions, perhaps?
Exactly. Klaus mentioned that conversations and interruptions contributed to the mistake.
hmm
Creating a distraction-free zone could help.
But is that practical in busy healthcare settings?
It's challenging, but necessary. It's like trying to write an important email in a noisy cafe.
Yeah.
Mistakes are bound to happen.
True, but professionals should double-check their work, especially with high-risk medications.
Of course. But human error is always a factor.
Right.
We need systems that support them, not just rely on individual vigilance.
So what about technological solutions? Could they help?
Possibly, but even electronic systems can fail or be bypassed.
hmm
Alert fatigue is a real issue.
That's when too many alerts cause people to ignore them, right?
Exactly. If they're bombarded with warnings, they might overlook crucial ones. It becomes
Right.
background noise.
So we're stuck in a tough spot. What's the solution then?
Maybe a multifaceted approach, better training, improved systems, and supportive work environments. Also, involving
Yeah.
patients could add an extra layer of safety.
How so?
Educating patients about their medications so they can spot errors.
That's a
It
good point.
empowers them to be part of their own care.
But isn't it risky to rely on patients for that?
Well, it's not about relying solely on them, but adding an extra safety net. It can't
Right.
hurt.
True. It's just so tragic when these mistakes lead to severe consequences or even death.
Absolutely. And it takes a toll on healthcare workers too. The
hmm
guilt and professional repercussions are heavy burdens.
It's like a domino effect of negative outcomes.
Exactly. One mistake can impact so many lives.
Yeah.
That's why addressing the root causes is so important.
Do you think the healthcare system acknowledges these systemic issues enough?
I think there's room for improvement.
Right.
Often, the focus is on blaming individuals rather than fixing the system.
That's a big problem. We need a culture shift towards safety and support.
Agreed. It's like in aviation, where they have rigorous systems to prevent errors.
Exactly.
We could learn from that.
So what's being done now to address these medication errors?
There are ongoing efforts like updated protocols and awareness campaigns, but the impact seems limited.
hmm
The errors persist.
Maybe it's time to innovate and try new strategies.
Definitely. We can't keep doing the same things and expect different results. It's
Right.
crucial for patient safety.
Absolutely. Hopefully, continued conversations like this will spark change.
Let's hope so. It's a matter of life and death after all.
Yeah. Thanks for bringing this up. It's been enlightening.
Anytime. It's important we keep these discussions going.
Definitely.